Welcome to the Endo Kids Podcast, the podcast where we help families navigate the ups and downs and in-betweens of growing up healthy. I'm Dr. Rinku Mehra, the founder of Endo Kids Concierge and a pediatric endocrinologist, and my co-host is Dr. Lindsay Waldman, who is also a board-certified pediatric endocrinologist. We are here to break down the science of hormones, share real stories, and answer the questions parents wonder about the most. So whether you're worried about growth, puberty, thyroid, or just want to understand your child's development a little bit better, you're in the right place. We believe every family deserves answers, support, and a caring partner in their health journey. So grab a cup of coffee, get comfortable, and let's tackle this topic together today. This podcast is for educational purposes only and is not a substitute for medical advice. Please consult your child's healthcare provider for individualized care. Hi, everyone. It's Dr. Mehra. I am here today at the Endo Kids Podcast, and I'm here with a special guest. Today, we are going to be talking to Kelsie Lewis, who is going to be talking to us about diabetes care. She's the founder of Balanced Diabetes Wellness, and I'm going to have her share her story because I'm so excited to talk to her about diabetes management and how she approaches it. Kelsie, thank you so much for joining me. I'm really excited to have you here. I think you have shared your story with me, and I think it's great for patients and other listeners to hear what you have to say about diabetes management. So can you share a little bit about your personal and professional journey into diabetes care? How did you get started in treating patients with diabetes?
Thank you for having me here. I love to share my story because I feel like there's a lot of individuals who can relate to kind of what I went through. My journey actually started about 18 years ago, and it started with my brother. My oldest brother went through all the typical signs and symptoms of type 1 diabetes. But because he was 18, his PCP wasn't checking for type 1 diabetes because back then it just wasn't really recognized, past, a certain age. And at 18, they assumed it was everything else in the book. And after losing about 40 pounds, my poor brother was admitted for DKA. And so it was there in the ICU that my poor mom and my brother were given that diagnosis. And I just remember how our entire family dynamic changed pretty significant overnight. And so with that, I was a little bit more aware of what type 1 was, but I was only 16 at that time. And so I could only pick up so much of it. And then about a year later, I started to have some similar symptoms. But at
Wow.
this time, I was 17. I was in a very competitive volleyball league. And so we were working out probably 3 or 4 hours a day and traveling. And so when I started getting the fatigue and all of this symptoms, it was kind of dismissed as, oh, you're just traveling a lot. You're doing a lot of
Wow.
exercise. We would prick my finger sometimes and it would show that there wasn't any elevation in glucose because of the amount of exercise I was doing. And after about 6 months of going through that, I just didn't feel very well. So we checked again on the glucometer, and that time it actually read 555. So
Wow.
there I was,
Wow.
self-diagnosed, and I went to the ER because that was we lived in a very small town in Idaho, and that was the only thing we could do, and I left with insulin that day.
Wow. So you went for 6 months really without being diagnosed, and mainly it was because of your exercise that kept your blood sugars low. Did you lose weight? Do you remember losing weight at all or?
I didn't lose weight, but I lost a lot of hair.
Interesting. Okay. So you self-diagnosed yourself with diabetes mainly because you knew what your brother had gone through.
Yeah. Yeah,
Wow.
absolutely, and without my brother, I probably wouldn't have because everybody was kinda dismissing it. Volleyball, maybe it's just your period, maybe it's mono because at that time, there was a lot of mono going around.
Mhm.
So, luckily, I was able to test using a glucometer.
Yeah, so walk us through what happened next. So after you got diagnosed and you continued to play sports, is that right?
I did. Yeah, so this was in the middle of my club season, which is typically spring, and so I did have to kind of slow down the season. I pretty much was benched for a couple of weeks, just trying to navigate the whole insulin eating, just trying to figure it out. Now, because my brother has went through it, it was a little bit easier because we had already knew what carbs were and we already went through most of that. But the trouble that I had personally was balancing exercise and the insulin to carb ratio and trying to prevent lows from happening because now I'm on insulin and exercising for those 4 hours. It was just a little bit chaotic. The season ended, and then it took about 6 months for me to like just put volleyball aside to start to gain a little bit more control. And then going into my senior year, I had about 13 schools looking at me for college ball.
Hmm.
And it was one of those moments where schools were kind of maybe a little hesitant to offer me that scholarship because I was still balancing, I was still in that honeymoon phase.
Hmm.
And so I had a lot of schools kind of pull out on that deal that we had been talking
Wow.
about. After my senior year, I just decided that it was a little bit too much to try to balance blood sugars and volleyball because all the schools were telling me no, anyways. And then I graduate from high school and I'm about 2 months out trying to figure out what I'm gonna do because I thought I was gonna go play college ball, and that was how I was gonna pay for school, and then I got a phone call from a coach in West Texas who said that their libero had basically given up her scholarship, and he was offering me a spot, and so I had 1 month to get on an insulin pump, get my blood sugars in control, and they give me this big laundry list of all of these clinical numbers I had to hit, and then I went off to school and I played for a season, and I never was given the information needed to balance my glucose at a collegiate level, especially. I mean, it was hard in high school, but at
Hmm.
a collegiate, when you're traveling as much as you are, there was a lot of things that I had to learn the hard way, I'll say. And it was hard for any of my healthcare providers to help me because at that point I was an adult and I was out of pediatrics. And so
Hmm.
most of those educators, they were familiar with type 1, but most of them had type 2
Hmm.
preferences. And so as we were trying to figure out how to adjust my basal and bolus so I could play, there was just a lot of like shooting in the dark. We really
Wow.
didn't know what we were doing at that time.
Wow. And so did that sort of shape what you wanted to do in college? Like that experience that you had?
Yeah, absolutely. I just remember struggling because I would be pulled off the court to fix my blood sugar, then I would go in and play, and I was so worried about my blood sugars, and I mean, how dangerous it is to have a
Yeah.
low. I was so paranoid, and there was so much fear around just staying alive that I really couldn't focus on the sport, and so
Yeah.
I remember at the end of the season, I sat down with myself and I had a hard conversation with my mom saying, "Look, I could stay in this, it could pay for school, but this is too hard. I can't do this alone." And I ultimately chose my health over my career in volleyball. And with that decision came if if s- if my healthcare providers right now can't help me, if they can't help me with this, then who's going to help others? I'm not the only type 1 athlete trying to do this.
Absolutely.
And because there was a lack at that time, I wanted to jump in and kind of start filling those gaps so that those who come after me had an opportunity and could play and not have to give up on it like I chose.
Wow, that's amazing. That's an amazing story. So, I mean, you really have, lived with this. And I agree with you. I think there are a lot of gaps in care for young athletes with type 1. And you mentioned, I mean, it is a life-changing diagnosis. I think, for myself also, even in training or fellowship, I had two physicians who trained me. Both of them had actually type 1 diabetes, but no one ever taught me how to manage an athlete with type 1. So those are things that I kind of had to learn also as a physician, having, treated patients. And I think it's, very different for you having gone through it really and then saying, well, there's no one to help me. So I need to learn how to do some of this. So tell us a little bit about, how living with type 1 has shaped the way you educate and coach others. So, you do have a practice now that you are helping others. Is that right? So tell us a little bit about that.
So I have a private practice where it is nutrition and diabetes education. I also do pump trainings as well. So we're kind of a comprehensive approach to diabetes management. But the way that I educate my own clientele versus what I have went through myself is I try to meet the person where they're at and show them more practical, compassionate ways of caring because diabetes the protocols that we were taught is very rigid, very cookie cutter. And sometimes that works for individuals, but a lot of the times the cookie cutter protocols don't work. And so we try to work around what each person is going through, whether it is, I mean, a lot of disorder eating. A lot of people with type 1 diabetes have some shame or guilt. They're very fearful of eating carbohydrates or lows. And so you're just trying to help them navigate through whatever stories have been created in their diagnosis story, trying to look for patterns instead of that perfection ultimately is what I try to do.
And how did your background in nutrition, diabetes, and personal training come together to create your practice?
So I chose to do all three of these because it was a part of my own story. I wanted to know how nutrition impacted my glucose. And then you've got to know the 101 behind like why your glucose raises, right? There's over 42 factors. And then personal training was just learning like how your body moves and how those hormones change and adjust. And so when I start piecing all those things together, you can kind of manipulate each part of that, whether it's the nutrition, the insulin, or the exercise to gain really good control of your glucose. And so a lot of the training that I do is just taking part of those variables and implementing like small strategies. And it really does help with your hormones, your health, your glucose, your well being, and just the confidence altogether as well.
Yeah, and what common themes do you see across type 1, type 2, prediabetes, gestational diabetes? Because I assume you're not just treating type 1 in your practice, right?
That's correct. Yeah, we do see all types of diabetes. I would say primarily we're heavier on the type 2 and the pre-diabetes.
Mm-hmm.
Type 1 is my baby, so that's that's typically who I see. But we do have 4 dietitians on staff, so we're busy with all. The typical trends that we do see is that your blood sugar management is way more than what you eat. Sleep, stress is a huge one. Illnesses, hormones, movement, just being consistent really plays a much bigger role than what we give it credit for, I feel like.
Yeah, and what are some misconceptions that families have about diabetes management? Like, what are the biggest ones that you see?
The biggest one, there's 2 common ones. The biggest one is that carbs are bad and you should avoid them and get rid of them. And that's not true. As we know, carbs are our energy. And so it's not to get rid of them completely. It's about finding that balance and finding the right carbs to kind of match what kind of energy you need.
Hmm.
The second one is and this one's more so for the pre-diabetes and type 2. We get this all the time. That individuals get really nervous to be put on insulin because they believe that insulin makes them fat and that they're
Mm,
going to gain weight. And it's kind of that forever drug that they're just, if they ever go on insulin, they can never come off of it. And so there's a lot of
hmm.
fear around insulin.
Hmm. Yeah, I think I hear that too. A lot of it is, at least the carbs are bad is, I think, big in social media now. And it always has been, I think. And I think, people without diabetes are looking at their blood sugars now and seeing blood sugars rise and thinking carbs are bad. So I think that is a very common misconception that I hear about also. But what myths about exercise and blood sugar do you hear most often?
Myths, I would say that a lot of individuals believe that exercise only lowers blood sugar. And even though that is true, and you can have low blood sugars due to exercise, in a lot of individuals and different type of exercise, like your really heavy lifts, sprints, can actually cause your glucose to rise. And so a lot of individuals just don't understand how hormones play a role in our exercise and then impact that glucose.
Yeah. I mean, I hear that too, and I actually see it. Like when you look at blood sugar data for anyone, really, you can see that exercise does, for different people, do different things, right? I don't think, like you said, there's not one size, fits all philosophy. So some people I will see with blood sugars that are low after exercise, but others they stay high for quite a bit of time too. Is that something that you see also?
Yeah, absolutely. And it depends too, like on who the individual is. There's a lot of women who have type 1 diabetes who also have like an undiagnosed PCOS. 1 in 4 women with type 1 have PCOS. And when they go and do cardio, typically we see the cardio decreases our glucose. But with women with PCOS, it typically actually shoots it back up too.
Hmm.
So we do a lot of weight loss for women with type 1, and that's honestly what I see a lot of.
Oh, wow. Okay. Okay, great. Yeah, I mean, what simple strategies do you talk about to help stabilize blood sugar swings day to day? What do you talk to your patients about?
Yeah, this is one of the biggest ones, right? There's a fear of going too low or too high too fast, and the biggest advice is to not be reactive, but be proactive. And so what I mean by that is maybe instead of waiting till your blood sugar hits 70 for that, like the Dexcom or the CGM alarms to go off, maybe set it a little bit higher. So you're at 80. So that way you have some time to maybe stick a glucose tablet in your mouth or go grab something without that, like that urgency or that anxiety that
Yeah.
hits that makes you run into the kitchen and you eat literally everything but the kitchen sink and then your glucose is up in the so if you have a plan that is proactive with the lows, that will prevent the highs. And then on the opposite side, for the highs, you just want to make sure at mealtime, it is so important to pre-bolus. If that insulin is a 15-minute onset, you've got to wait at least 15 minutes. And that's the hardest thing, especially for myself. Pre-bolusing is tough because you look at the plate, you think you're going to eat the 30 grams, you might get halfway through and realize you only want 15 grams, but you've given yourself
Yeah.
for the whole plate, so you're forced to. So then a lot of people choose not to pre-bolus, and then that's what causes a lot of those highs. I feel like a lot of individuals who have had type 1 for quite some time, they don't realize that we've got quicker insulin now. So the Fias, the Lumjeb, even the Frieza, the inhaled insulin, there's options so that way we don't have to pre-bolus as long. So I would say those are the big two to prevent the ups and downs.
Yeah, that's great advice. With regards to meal planning, though, do you plan differently for type 1 versus type 2 when you talk to your patients?
Say it's slightly different. The difference between the two is more so of the consistency of carbs. For somebody with type 1 or 2, they need a certain level of all the macronutrients, so protein, carbs, and fat. So it's not that you have to limit one more aggressively for type 1 versus type 2, but with somebody with type 1 diabetes, they might be able to go a little bit higher on their carbs, let's say for dinner, as long as you're pre-bolusing and counting your carbs appropriate and covering the carb. Where somebody with type 2, you want to keep it pretty consistent, where for most women, it's usually 30 to 45 grams per meal. And for men, it's typically 45 to 60, just depending on age and activity.
Hmm.
But trying to be more consistent with your carbs with type 2 or type 1, you can kind of mix it up a little bit more.
Okay, yeah, great advice. That's great advice. I want to go back a step, something you said earlier about a myth, about, insulin making you gain weight. And, how do you balance this weight management goals and, preventing hypoglycemia with type 1? Because I've had patients also who, like you said, are worried that they're going to gain weight with insulin. So what do you tell them and how do you balance that?
Yeah, this one's kind of a tricky one because a lot of individuals, they'll start working out. And then as they're working out, they become more sensitive to the insulin. Then they consume the carbs to treat the low, and then their blood sugar is way back up. They're giving themselves more insulin. And then they start to see the scale either not move or actually end up getting higher. And
Hmm.
so they blame it on the extra insulin that they're consuming. Where if we can break that cycle of having the low in the first place or slow down the amount of times you're having lows. That is a trick that to focus on because most of my clients, before they work with me, they're consuming about 100 to 500 calories per treatment. So a lot of individuals, they're
Wow.
grabbing a bunch of candy or cracker, like peanut butter crackers, and that's getting upwards of, yeah, 250 calories. And if you're fixing 2 lows a day at 250, that's an extra 500 calories a day, which equates to about gaining 1 extra pound per week.
Wow. That's amazing. Yeah,
Yeah, so
yeah.
I would say the biggest strategy is first, make sure that the low treatment options that you're doing has a lower calorie count. Do something that's really simple, like glucose tablets are the lowest ones on the market. You get about 40 calories. 100% fruit juice gets up, about 60 to 100 depending on which
Mhm.
fruit, but those are the 2 lowest ones and they're the quickest ones too.
Mhm. Mhm. Yeah, and I don't know, how easy it is to overdo it on the glucose tablets. I don't know what you think about that. So
Yeah,
versus
that's
some of the other.
yes.
Yeah, they don't taste that good. Yeah, yeah. So yeah, that's great advice. So I want to shift gears a little bit and talk about some technology. I think, since I started managing diabetes, which was many years ago, technology for diabetes has just advanced so rapidly. How do you teach families how to interpret, these continuous glucose monitors without feeling overwhelmed? Because I think, it's become a lot of data, and I remember when I was training, it was, you're pricking your blood sugar and asking patients to prick their blood sugars, 6 times a day, 8 times a day, checking your blood sugar overnight. Parents are overwhelmed. They're having to wake up in the middle of the night, test blood sugars. And that's gone away and not completely, but, a lot of that has gone away and that anxiety about hypoglycemia with the CGMs. But on the flip side to that, I feel like there's a lot of data there, so now we're looking at every time we eat something or have physical activity or exercise or stress that, something is happening to the blood sugars. And how do you teach families how to interpret that without feeling completely overwhelmed?
Yeah, that's a great question because the data can be overwhelming. And a lot of times, too, whether it is the client themselves or family members, sometimes there's some judgment or guilt or a shame with the numbers. And so some people will actually start to feel guilty that their numbers are a certain level. And it's almost like they feel like they're being judged. And
Yeah.
if I can really break it down to them, and sometimes I even share my CGM, I'll say, hey, look, this is my CGM report. Let's look at it. I too get up in the 300 sometimes. And this is totally fine. And so, what I think when they start to realize that it is normal to hit 300, it does happen, right? It's normal to hit a low. It's something to be expected. Yes, we can avoid it and we're trying to shift away from it, but, kind of normalizing that there is gonna be a little bit of a roller coaster is something that I do, especially with kind of the newbies. And then I always talk about we're not trying to fix everything at once. We're gonna pick one priority, and
Hmm.
for me, it's safety and it's lows. So if you're having multiple lows, we're gonna address that first, and if that means that A1C is gonna go a little bit higher so we can get rid of those lows, we're gonna get comfortable with that.
Yeah. I mean, that's a great point. And the other issue is, I do agree with you. I think safety for patients with type 1 is super important. I mean, having treated many patients with low blood sugars also. And then, especially in sports and overnight, also really focusing on preventing lows, I think is super important. The other piece of this is technology has changed diabetes so much. Do you think there is like a CGM feature or even a pump feature that's like underutilized or the most underutilized?
Most under for CGMs. I don't know if I would say underutilized, but maybe mistaken,
Hmm.
and that would be the trend arrows. I A lot of individuals that talk to, we know, when our glucose goes up, there's a 45, there's this like a straight up, and then
Hmm.
there's like 2 straight up. But a
Hmm.
lot of people don't actually know what those numbers are, and
Hmm.
so it causes more of that reactiveness. If you can understand that if you are slightly up or slightly down, that is only moving your blood sugar 1 to 2 milligrams per minute. So that's
Mm,
only about 30 point over 30 minutes. And so if you understand that, I think it helps with the anxiety of, oh, I'm not dropping that fast.
I
It's
see.
pretty slow, actually. So
Yeah.
I think if you can look at the numbers, it does help people not rage bolus to come down or over
Mm,
and come back up.
yeah. I see that a lot. I like that phrase that you just used, rage bolus, because I think I see that quite a bit. Like you're starting to see some of those trends go up and then, the number, putting straight up. And I see my patients panicking and then they're like bolusing and bolusing and bolusing. And then they have this huge drop of blood sugar. So you're sort of chasing that big, drop that you have then.
One more thing on that too, and this a lot of individuals think that the CGM is exactly what your glucose should be in that moment.
Hmm.
And so understanding that it is you're testing two separate things when it's a finger prick versus your CGM. And what I like to teach is your CGM is the back seat of the roller coaster. Your finger prick is it's the front. So if you know when you ride a roller coaster, you're going up and the bottom is maybe not even moving. And then by the time it starts dropping here, your CGM is on its way up. So it's
I see.
not a perfect alignment sometimes. And
Huh.
having more patience with your CGM, I think, is really important.
Yeah. So do you guide them to just wait a little bit to see what the trend is? Or what's your guidance with that when you see, that trend?
Yeah, it depends probably on like the anxiety levels of the parent or the child, but I would if they're willing to sit and wait for 10, 15 minutes to see if it slows down, that's
Hmm.
what I recommend if they can. Just a finger prick. Pull that
Yeah.
glucometer out and just double check.
Yeah. Yeah. Great advice. Great advice. And knowing what you know about your own management with diabetes and how you were diagnosed, and then you said you rapidly had to get on insulin pump. What can you say about how this technology for you and even for your patients makes diabetes management easier for kids in school, or does it make it more difficult? What is your thought about that?
There's pros and cons for sure. I believe that there's more pros right now. The CGM features are really cool because now you can share it with your school nurse, your parents, your teachers. You can have multiple people following so that way you can be more proactive or pull the kid out of school or out of the sport even. I know for myself when I was playing 17 years ago, this is when the Dexcom just barely came out, and it was that big egg,
Yeah.
disc, and my
Yeah.
coach would hold that disc, and he would follow me up and down the sidelines to make sure I was within 20 feet,
Wow.
and then he knew, like, when it got to a certain number, you pull me out so I can go get, something so that I'm not having to, come out
Yeah.
in the 70s or below, and so I think there's a lot of pros. I know some kiddos get embarrassed by it or they feel like maybe they're holding their team back. And I get that. I've felt those emotions too. But ultimately, it's a blessing to have these because if not, some kiddos don't feel that they're low until they're about to pass out. So
Yeah. Yeah.
I
Yeah.
think it's saved more lives than the other way.
Yeah, I agree. I agree. What do you tell parents who are afraid of exercise because of lows?
Yeah, this one's tough. I share my story. I share things that I went through. I do talk to them just about how I do set all my protocols to avoid lows and that we've got strategies in play. So if they're on an insulin pump, I go into great details about how to use your activity mode correctly, when to eat, how to eat, and trying to balance the glucose a little bit more. And if they still feel uncomfortable, we just take baby steps. Even if
Yeah.
it's just, like they run around the block one time. You have to meet the parents where they're at, but ultimately the kiddo can have a healthy relationship with sports. It's just making sure that you always have extra low treatments.
Yeah. That's great advice. That's great advice. And I like that you said, meet the parents where they're at because this is, like you said, life-changing diagnosis and it is very anxiety producing for the child, but also for the parents. So I think that's important advice. Have you seen athletics improve overall diabetes management?
Yeah, I would say so. Because with these gadgets and everything that we have, the insulin pumps, the CGMs, when you start to trust some of these devices and use them the way that they're designed, you can actually worry about your glucose less. Versus when potentially, like when you don't have eyes on you, you might in the back of your head be chronically worried about the glucose. So as you do get better and more involved and you understand how your body functions and exercise, your athletic performance does improve. I think a big part of this too is making sure that just make sure that the kiddos don't fear carbs because carbs is the
Hmm.
energy.
Hmm.
And if we completely remove the carbs from the diet, athletic performance won't improve because they don't have
Yeah.
the energy to be able to
Yeah.
perform. So it's
Yeah.
all about balance with the insulin and the carbs and making sure that we're hitting both marks.
Yeah. Absolutely. Absolutely. Great advice. As someone living with type 1, how do you manage your tough days? Like you mentioned, you have blood sugars in the 300s. Or, what do you do? How do you manage?
Yeah, this one took me a while to get, but grace. You've got to give yourself a bunch of grace. Burnout
Mm.
does happen. It doesn't mean that you don't care. It's just you've been carrying it for a long time. So even though like it may feel heavy in that moment, it's self-care. If that means that you've got to create a plan where for that day you're just eating some kind of basic foods that you know that how they impact your glucose, maybe take it a little bit easier and maybe instead of trying to get down to that perfect glucose, maybe you have a range and you just allow that range to be what it is for that day and have no judgment with those numbers.
Yeah, that's great. I mean, great advice because I think you're right. I mean, those CGM numbers, I often feel like have told my patients it's not a report card. We used to run Cs, every 3 months, and I remember, patients saying, "Well, what's my A1C?" And it's kind of like a grade. Like, is it going to be an A? Is it going to be a B? And really, it's managing trends and, like you said, giving yourself grace, and then learning from that, and learning from your body also, how your body's responding. And I usually tell my patients, we're trying to mimic the pancreas and we're trying to do the best job that we can, but we're not perfect. So you're right. I mean, give yourself grace with some of that. I think that's great advice. You did mention something about, diabetes burnout. How do you support clients through diabetes burnout?
So we actually have a few therapists that we partner with.
Hmm.
Two of them here locally actually live with type 1 diabetes. So it's so they know the grind, they know that. And so it's one of those things where I feel what's helpful is when you're talking to somebody and they actually just understand the burnout. Because if you're talking to somebody who doesn't fully understand it, it's hard to explain. If it's we do connect them to the therapist if they feel like that's appropriate for them, or we also have community. So we have like quarterly meetups here where we just kind of all hang out and just talk about what's going on. And a lot of the times that helps just when somebody sits down and say, "Hey, I'm having a hard time." And it's just like this open um support group in a sense. So you can be in a place where you don't feel like you're being judged.
Yeah. Yeah. And I think that's very important because diabetes burnout is real, and it is great to have resources and support groups and people to share that with. And therapists, like you said, I think are a key piece of this as well because it is, like you said, life changing diagnosis, and it's a lot to look at and manage on your own. So I think that's super helpful to have a team approach. So, what's one tool or app that you recommend to most clients?
Great question. It probably depends on what kind of treatment they're doing. If they're just daily injectables, I would say the InPen. InPen is a great tool. You're still just doing those daily injections, but then it's following you and letting you know all the details, which
Hmm.
is really great. We've talked about the CGM and having the follow apps. So having at least one person following you. And then a big one, especially for these kiddos. Have you heard of the sugar pixel before?
No, I haven't.
The sugar pixel, it's like an alarm clock. It's big numbers. It actually hooks to the CGM. So it reads the glucose and it has the trend arrow on it. And you can set different alarms to it and they change every time it goes off. So that way you don't get that alarm fatigue, because a lot of kiddos will sleep through their lows because it's
Uh-huh.
the same ring over and over again.
Uh-huh.
And so for every time it gets louder and louder, it changes the tone. And then they also have a little disc that connects and it goes under your pillow and you lay on it and it actually
Wow.
vibrates. So it's a really cool gadget to have. I've got one and I'm a heavy sleeper and I cannot sleep through this. I mean,
Oh, wow.
it will wake you up.
Okay. Okay. All right. Good advice. Good advice. That's great. What is the best diabetes advice that you've ever received?
The best I've ever received, naturally, I'm a perfectionist at heart. Chase the progress, not the perfection.
Yeah. Great advice. Great advice. And where can families connect with you or your team to learn more about your practice?
We have a couple different resources. We are on social. So we have an Instagram and Facebook, and it's just Balance Diabetes Wellness. So that's for some like fun, free education. Or you can call directly to our office, which is 817-518-7239. We take insurance and we are in over 23 states. So it really doesn't matter what state you're in. It's just that's what we can for insurance, but we do cash as well. So yeah, if anybody is interested in learning more, I mean, I would say call. That would probably be the fastest way.
Yeah. But this has been very educational, enlightening for me also, I think for our listeners. If you need care, if you're a parent or a patient and you are struggling with diabetes, don't hesitate to make an appointment with us at Endo Kids Concierge and we will get you hooked up with Kelsey also. But you can reach out to her directly as well because I think she is seeing patients, like she says, in multiple states. But Kelsey, thank you so much. This has been so helpful and so enlightening. And if you like this episode, please like and share it with somebody else with diabetes or someone else who you think could benefit from the podcast. Thank you so much.
Thank you so much for joining us on the Endo Kids Podcast. We hope you're leaving with a little more knowledge and a lot more confidence. If you have questions, stories, or topics you'd love us to cover, please send them our way. We love hearing from you. And don't forget to check out our website, www.endokidsconcierge.com, for free resources, guides, and more ways to connect. You're not alone on this journey. We're here to support you and your family every step of the way. If you enjoyed this episode, don't forget to subscribe to our podcast so you never miss an update.